Performing CPR on a baby is very similar to performing CPR on an adult, with a few exceptions. The first one being the head position for an open airway. With adults, we use head tilt to open our airway. With babies, they need to be in the neutral position, which means the head's not tilted too far backward or too far forward. The second exception is when we perform our compressions. Placing the baby on a firm surface, your fingers will slide behind the back, which lifts the head into a nice neutral position. Thumbs come to the sternum and perform your compressions. If you do have a nappy nearby or a blanket, not a bad idea to place that underneath the shoulders. That'll maintain the head in a nice neutral position whilst you're doing your compressions. The last exception is when we deliver our breaths. The volume of air that we deliver is obviously greatly reduced. It's a puff of air rather than a full exhale. We still follow our doctor's ABCD when responding to a baby, checking for danger, making sure there's no hazards to yourself. When we check response, it can be as simple as scratching the bottom of the foot or pinching the earlobe to try and get a response. If the baby's not responding at this stage, send for help. Very important step. We check the airways are clear them if required, and we check for breathing, the same way we would an adult. If the baby's not breathing, we start our CPR with our compressions to begin with. The ratio is the same, 30 compressions to 2 breaths. In years gone by, you may have been shown to perform CPR whilst holding the baby in your arms. It's recommended now to perform it on a firm surface as it increases effective CPR.